Oh. That's what I'm yeah. Hey.
Trying to apply monitors.
Hello. Hi guys.
Bridget, how are you?
How are you?
Alrighty. So we've got Adam here. He's a 69-year-old male.
Hello.
He lives alone at home by himself. We were called to him initially because he was short of breath, with some dizziness and lightheadedness.
I feel good now.
Said it lasted for about 15-20 minutes and then went away on its own in the time between he called us and when we've arrived. So we've only just got here.
I'm really sorry for
He's got a nice strong radial pulse at about 60. Says he only takes one medication with not a lot of medical history at this stage. So good strong radial. He looks really well confused at the moment. But yeah, reports that dizziness and lightheadedness.
Sure, I'll give you a hand when you get a full set of obs and we'll see where to go from
This
there.
thing's really tight. My blood pressure.
That's alright, mate. It's just giving it a squeeze. That's
I'm really sorry for calling you out. I feel really good.
It sounds like you were feeling really bad earlier.
Oh yeah, I was feeling lightheaded and dizzy.
What started that feeling?
I'm not really sure.
You check your temperature.
Okay.
Do it by yourself, boy,
Thank you. And can I take your pulse?
Well, you don't want this one's down.
So, tell me about when this feeling started. What happened? What started it?
I think I was just sitting down and just made me feel a bit lightheaded and dizzy and I didn't feel too good. So I called you guys, but now I feel great.
Anything else? Any pain? Weakness?
Maybe some palpitations.
Your heart was racing?
I think so.
Where did it feel like your heart was racing? Was it in your chest or up in your neck?
Yeah, just.
Okay. Did you feel sick or nauseous? Were you sweating?
No, maybe a little bit nauseous, but that's all past. So I feel really good.
Excellent. Okay.
BSL's good. Temperature's good.
Yep.
Alright, you're working on the 12 lead? Yep. Excellent. Can we see that medication you're on?
Oh, it's just solitol, that's all it is. Okay. Yeah, it's real simple.
Okay. And have you been taking it?
Oh, yeah, I'm pretty sure I have.
Yeah. What do you take? Is it 2 a day?
Whatever in my book.
Okay. Yeah. You do what you're told. You're good with your medications.
Yeah, I've tried it, yeah.
Excellent, yeah. Okay. It sounds like you were feeling quite unwell earlier. So
yeah, I was.
Yeah, and I know you're feeling better now, but I think what you're describing is a little bit worrying, so we'd like you to come to hospital with us anyway. Even though you're feeling better now.
No, I feel pretty good now.
I think it's important.
Yeah, like I feel.
We can just pop you over. You've gone into pacing now. Be careful.
Yeah.
We could just pop you over to the hospital to do some blood tests and see how you are. Is that okay?
I'm actually starting to feel a little bit.
I'll check your pulse. Can I check your pulse? Guys, can you have a look on the screen there, please? What have we got on the screen, Jamie?
What are you going on the screen? Oh, good.
No, we've got BT on screen. So Adam, it's important that we get you lying down. Alex, will you go on the other side of him there and we'll just move him from the chair. We're just going to get you down onto the ground. Can we do that?
Put the pads on and it's in manual mode for quiet.
Okay, so are we down on the ground now?
Yeah, right. Yep.
Yeah, okay, we'll move out of there.
Do I still have a radial?
Really, really weak and fast.
So I've got it carotid?
Yep, present.
Did you get IV access?
IV access?
Please?
Yep.
Yeah, you're running that
I can
12
do that
days.
here, mate.
Excellent, I'll set up for you.
So Adam,
So you're still talking, mate?
Yes.
he's talking?
Okay.
Yeah. Okay. Adam, your heart is going really quickly, and that's why we're worried about you. We've got you lying down. So we'll have to sort that out and see how it's going. So that's just running all the time in VT?
Yep.
Yeah. You're working on access. Alex has put the pads on.
Yeah.
Yep. SATs at the moment?
They come back at 94.
I just feel lightheaded and dizzy.
Yep. Okay, so we need to be keeping an eye on the screen. Has somebody got that? Yeah, that's good. I can see it from here now. You've got that, can you, Lane?
Yep.
Excellent. So, Adam, are you allergic to anything?
No, but I know, no.
Have you taken any other medications today?
No.
No? Okay. And when we get a chance, can we print a little bit of that, please? Just so we can have a look at it.
There's your flash.
Yeah. So we're 12 lead on now. Can we print 12 lead?
Yes, that comes back as an obvious VT.
I might just move this over so it's
And
up here closer.
not torsade, it's just VT. Okay. And it's just continuing to run.
Yep.
It's been more than 30 seconds now. So since that started, we need to get a new blood pressure.
Yeah.
You said a weak radial earlier.
Yep, so there's no obvious radial there at the moment.
Okay, yeah. So, guys, just so we're all on the same page, he's gone into a sustained VT.
Sure. Yep.
It's having some effects on him in that he's weak, he's drowsy, he's feeling palpitations and he's lost his radial. So we're going to have to deal with this. The best thing we can do for him now is cardiovert him.
Yep.
So we need to set up for that. So we need to give him some pain relief and sedation. And we need to be organised in case he loses his pulse. In that case, you start doing chest compressions and you get your you get on the head.
On the head? Yep, sure.
We have
Background mask?
Yes, yeah.
Yeah.
So all that's open here. We're good to go with that. We have IV access. So are you doing fentanyl and midazolam for me?
Yes, is that what you'd like?
Yeah, that's great.
100 mics in 10 mils
Yep.
of fentanyl and 5 milligrams in 5 mils of midazolam.
Yep.
Correct?
Excellent. Pads are on front
Oh.
and side. And then you
Fentanyl,
just pop on
100 mics in 2 mils,
nasal cannula.
expiry 2019.
So Adam,
Yes.
your heart is going very, very quickly at the moment and your blood pressure's bottomed out. That's why you're feeling so awful.
Yeah.
So we're going to try and get that blood pressure back up and get you feeling better. To do that we need to just put a little bit of electricity through your heart. So it's just a little tickle of electricity to try and get your
Why
heart
did it
beating.
just pass like last time?
It might, but the other problem is it might get worse. So in the meantime we're just going to get organised. We're just getting some pain relief for you in case it hurts a little bit, so you won't even feel it.
Midazolam, 5 milligrams of 1 mil, expiry 2019. Drawing it up in 4 mils of saline.
So have you any pain at the moment, Adam?
Oh, just the discomfort in my chest. I still just feel a little bit lightheaded and dizzy.
Yeah. Okay.
So I'll give you the drugs. Sure. And you've got your flush there.
That's the one.
Alrighty.
Station out,
So that's
fever
yours?
out.
Yeah.
So everything's staying the same with him?
Yep.
He's not changing, he's still talking to me?
Yep.
Good.
But that's fentanyl drawn up, Rich.
Excellent.
So would you like me to jump in there?
Yep. So I'll leave you here in a second. I'll go over and do the monitor. So we've got midaz and fentanyl drawn up. So have we got a blood pressure now?
It came back at 90 systolic.
Okay. So will you give 25 mics of fentanyl, please, and 1 milligram midaz? Alex, would you just get a bag of fluid from that bag over there?
Absolutely.
Just ready to go. Excellent. Okay, Alex. No, Adam. That's the problem.
Sodium
How are you
chloride,
feeling right now?
0.9%, expiry
Yeah, I
January
still feel
19.
the same, lightheaded and dizzy.
Okay, we're just giving you some pain relief to make you feel a little bit better. I'm going to go over here with the machine.
You're there, mate.
Excellent. The fluids are ready. Excellent. So I'm just setting this to 100. So while we have the pulse, we'll cardiovert him.
Cool.
You've got that ready?
Almost.
Yeah, excellent. Okay. So how's he feeling since the midaz? Adam!
A little drowsy.
Yeah, so his eyes, the voice, yeah, open
Yeah.
his eyes.
And he's at 25 max fentanyl, is that right? Yeah, okay. So, Adam, we're going to give you a little bit of electricity through your chest now, just to still say, just to try and get your heart beating correctly. And I'm just checking that this is synchronized.
I just doesn't have it.
Okay.
Just double check that's
Yeah.
enough, or it's 0.9%
Yeah.
January 19.
You'd hardly feel it at all, so this is synchronized. I'm happy with that. The fluids are running.
I'll put them on
Yeah,
right now.
okay.
Oops.
And then after
Sorry.
that we're going to,
Fluids are on.
so we're ready to shock now.
Yeah.
That's there.
Charging up to 100, sir. You can put them down. Yeah, thanks, clear. Sorry, Adam.
Ooh.
Still looks like PT on screen.
Mhm.
Check pulse, please.
Do I have a carotid?
Adam, how are you feeling?
Oh, same, yeah.
So talking here.
Yeah, still moaning, groaning a little bit.
Yeah.
Can I give another 25 mics fentanyl,
Sure.
please? Yeah. So Adam,
Yeah.
still conscious but weak. Yeah, so we're going to shock again. We're at 150 this time. So you continue with that, Jamie. I won't shock you, I promise. Alex, you're going to be ready if anything changes. So tell me when you're done, Jamie.
Done.
Done. Okay. Shock. Clear. Did you check pulse?
Checking your carotid.
Adam, how are you feeling?
Yeah.
Same.
Still
Carotid
the
present.
same.
Okay.
This isn't helping.
Sorry, mate, but don't worry, you won't remember. So another 25 miles fentanyl. The
Just going
fluids
in.
are running. Nothing changed there.
Mm-hmm.
We have a carotid pulse, but no
Yes.
radial. Is that right?
Mhm.
Okay. I'm going to shock again at 200, and that's the last one. So clear for another shock.
Clear.
Everybody clear. Ready? Stand clear. Shock. Shock delivered.
Oh.
Carotid pulse, please. With a change in rhythm on screen. It looks more positive. He's
Do I
back
have
to
a
a rate of
recording?
88. Is that correct?
I'm starting to feel
So we have
better.
a narrow complex.
Sorry?
We have a narrow complex with a rate of 88.
Mhm.
Yeah, that matches his carotid. Have we got a radial?
Yeah, you got a radio back.
Okay, I'll just run a quick blood pressure. So, Adam, are you feeling better?
Yeah, I feel a lot better.
Excellent, good job. So we just had to shock your heart a little bit to get it working better, and
Okay.
it's doing much better now. So that's good news.
Yeah.
You're going to have to come to hospital with
Oh,
us.
I don't think that's necessary, actually.
Yeah.
I'm happy to stay home. You
Okay,
know,
yeah.
I feel better now.
You can stay home, but you'll be on our stretcher.
Well, no,
Yeah.
I'm
So-
going to stay home. I'm happy to stay home.
Will you get the stretcher and start to get us
I'll go
sorted?
in and get the stretcher.
Yeah. Okay. Fluids are running.
Yes.
No.
Would you like them cut off? Or
Yeah, we'll turn them off.
Well, I'm happy
The
just to
blood
stay
pressure
at
come
home.
back.
Yeah, 120 on 80.
Okay.
Happy to stay at home. I feel a lot better. I'm not concerned if this sort of takes my life or anything like that. I've had a good life. I just want to. If I die peacefully, I'm happy with that.
Alex, will you keep an eye on the monitor
Yep.
and make sure nothing
Yep.
changes?
Yep, for sure.
Stretcher set up.
Print
Rich.
off a 12 lead, excellent.
I'm
And
not
I'm just
going
going to
anywhere.
have a chat with the patient. So,
I'm happy to just stay at home.
yeah, I understand we're not happy to leave you here.
Sure.
Yeah.
I understand your concern, but
Yeah.
the thing is, I feel fine now, and I'm happy to stay at home.
Okay. Do you have any family or anyone like that?
No, my Dorothy, she's just died. You know,
Is that your wife?
Yeah, she's
Yeah.
gone.
Oh,
And you know, like if I died today, I'd be happy to go and spend time with her. You know, that'd be okay.
Okay, yeah. Well, I'll explain to you what's happened so far and what we're worried about.
Yeah.
So your heart is going very quickly some of the
Mhm.
time and not beating very effectively.
Sure.
And that's when your palpitations start, and that's
Mhm.
when you feel weak and dizzy.
Sure.
And the last time that happened, your blood pressure went really low,
Yeah.
and you were feeling awful, and you had pain in your chest.
Mhm.
Yeah, is that right?
Yeah.
So then we gave you some medications, so you don't really remember things very well.
Yeah.
And after that, then we shocked your heart a couple
Yeah.
of times,
Sure.
and now it's back into a normal beat temporarily.
Mhm.
But like you say, it's very serious, so you understand it's very serious.
Yeah, I understand that's very serious, but I'm happy to stay
Yeah.
at home. I thank you for your help. You know, like I'm not concerned if this does go southward.
Mhm.
I understand the risks, and I wish to stay at home.
So we've given you medication that stops your brain from working very well. So
Okay.
that means that you can't think or remember very clearly.
Oh well.
So even though you sound like you're making sense to me, you're making a sensible decision. Because of the amount of strong medication we've given you,
Mhm.
we're not able to be certain that that's the right decision that
Oh,
you're
well,
making.
I'm pretty confident that I'd like to stay at home. I feel that now that you've given me the treatment, I feel fine. Like I'm
Yeah.
able to function. I should be able to do what I need to, and if things happen, I'm sure I could call you back again.
Yeah. Well, we've not really given you treatment, we've just stopped the
Mm-hmm.
immediate problem.
Okay.
You still haven't had treatment, you're going to have treatment in hospital. Otherwise you're going to get that terrible pain back again.
Oh well.
You're going to feel really unwell.
I guess if that comes back, I would just call you back,
Yeah.
and you know I could go see my GP tomorrow, or you know, like I'm happy to stay at home.
The bottom line from our point of view at the moment, Adam, is because of the strong medications we've given you,
Mhm.
where we know that it stops you remembering and thinking clearly, means that you have to come to hospital with us.
No,
So
I don't-
even though you don't want to, and even though you'd rather not,
Mhm.
and even though you seem to be making lots of sense,
Mhm.
because we've given you so much strong medication, we can't leave you at home.
I'm going to refuse your transport option. I'm going to stay at home.
You, at the moment, you don't have the capacity to refuse.
Oh wow.
So that means we can judge that your brain isn't able to work well enough because of these medications, that you don't have the capacity to refuse. So that means that you're going to have to come to hospital with us today. We're going to take you to hospital, unfortunately, whether you like it or not.
Can I?
So later, when you're in hospital and the medication is worn off, if you want to leave, then nobody can stop you. But right now, you don't have strong enough decision-making ability for us to be able to leave you here.
Can you ask me questions so I can prove you wrong that I'm able to stay at home? Because I would really like to stay at home. That is my only wish of today. I'd really love to stay at home.
The medication we give you has amnesic effects. That means you forget things.
Mhm.
And one of the important elements of you having the capacity to consent or refuse to treatment is that you remember.
Yeah.
So we've given you drugs that takes away the remembering.
Yeah, sure.
So even if you sound like you're making lots of sense,
Mm-hmm.
and you do, and I understand that you're making what seems like the best decision for
Yeah.
you at the
Oh, I
moment.
think me staying home is best for everyone here. You know, like you guys can obviously go and do something more serious, and I can stay at home. I'll be happy to stay at home.
Mhm.
I'd really like to stay at home.
Yeah,
I don't want to go to hospital today. I feel good.
but you understand you're going to have to come with us anyway.
Well, I'm still going to refuse.
Yeah.
I don't want to come willingly at all. I wish to stay at home.
Yeah,
It is
I
my choice, and I
understand.
want to stay here.
You can make the choice, but we can't abide by your choice at the moment. Later in the day, when you're feeling back to normal, if you decide to refuse, then they can't stop you, or we can't stop you. But right now, we have to take you to hospital.
I wish to stay. I don't want to go.
Okay. So how are we going to get around this?
Well, basically you guys leave and I stay at home. That
Yeah.
seems to be the easiest option here.
Or you come with us and you come home later?
No, I wish to stay at home and, you know, just stay here and cook dinner like I would normally do and watch TV and go to bed. I don't want to go. I really wish to stay
Okay. Well, we've kind of reached an impasse where neither of us is going to go in, give in at the moment.
here. I think.
So I'm just going to be clear with you.
Mm-hmm.
We're not leaving you here.
Okay.
You're coming to
Are
hospital
you
with
staying
us.
here overnight then with me?
So-
Because I'm not going anywhere. I'm staying home.
So there's a few options.
Yes.
We may have to give you more medication to force you to come with us, but we'd much rather not do that.
Okay. I don't get
We can talk to somebody else. If you've got some family or your GP or someone like that who you would take advice from.
Okay.
Is there anyone you'd take advice from?
Oh, not really. Dorothy's really the only one and she's really fast. I'm happy just to stay at home.
So
Yeah.
you mentioned your GP earlier. It sounds like you get on well with your GP.
Oh, he just looks after me, makes sure I'm going.
Yeah, yeah. Would you like us to have a chat with him and see what his advice to you is?
No, I'm pretty adamant that I wish to stay. That's obviously my choice. I believe that I can make the right decision for myself and I wish to stay.
Okay. You're remarkably well for someone who says it. Madonna's laugh. So we're just going to continue with the same issue. We're not accepting that you can stay here. We're not allowed to leave you here.
Maybe.
Right, stop there. Kill the video.